right? So you're able to do all these things, and it's crazy to think that exosomes, this little nanoparticle, they're about 100 nanometers in size, has so much potential, has so much packed into it, right? So it's really kind of changed the conventional way of thinking and really changed the paradigm in terms of regenerative aesthetics.
Hello everyone, and welcome back to the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And today is no exception. You're going to learn all about exosomes and the company Benev. And we have Ethan, who's here, who's come in from Korea. You heard me right. He just flew in from Korea to be on this program. And Dr. Jen, who came up from Temecula down in Orange County. Welcome, gentlemen.
Thank you so much.
You may recognize Ethan. He was on a very brief show and at the American Brazilian Aesthetic Medicine, or ABAM, meeting in Park City this last February. And I asked him to come back with Dr. Jen because I was so intrigued by this whole concept of exosomes. But first, I'd like you to get to know these fine gentlemen. Ethan, tell us a little bit about yourself. Where'd you grow up? Where'd you go to school?
All right. Well, first of all, thank you so much for having us today. It's an honor to be a part of this.
It's my pleasure.
Yes. And then I really enjoyed it first talking, and again, I really wanted to come back. So thank you so much. I grew up in Korea. I basically was raised there all the way up until 1996. And then again, obviously for school options, and I left Korea, and then again, traveled around the world, backpacking, and then again, decided to come to U.S. to study. Okay. So that's how I ended up in U.S. And I finished my undergrad private college in Chicago and Moody in 2005, and then I moved out to California.
Okay.
And then I did my MBA here in State College, Cal State Fullerton's, and then again I finished my finance as MBA. And then I joined the company in 2006 to the Benev. And then again, obviously, I've been since with the company. And then I did my MBA during my full-time work here at Benev.
So you've been at Benev that long?
Yes.
Okay, I didn't realize that.
I started as the just customer service representative, calling doctors' offices to introducing our products. Back then, it was still medical aesthetic field, and then stayed. And then again, I've traveled around the world, obviously as an international sales directors, establishing our product line and selling our products to 16 different countries. And then again, I decided to come back here, and then again, start leading a company as general manager, president, and then again, 5 years ago, I became a CEO of the company.
Wow.
So
that's very impressive. So you know all the different positions in your company.
Yes.
And now you're the CEO.
Yes.
How about you, Dr. Jen? Where'd you grow up?
So born and raised in Orange County. I did my undergrad at UC Irvine, did my medical school, my MD, PhD on the East Coast, Boston University and Brigham Women's Hospital. My PhD work was molecular medicine or translational medicine. So that's kind of my background or expertise, taking something conceptually, doing research in vitro on kind of the benchtop, and then translating it into therapeutics. So I graduated undergrad in 2001, graduated medical school in 2013, came back out here to do internal medicine residency at UC Irvine again.
Okay.
And here we are today.
Are you practicing medicine now?
I am practicing medicine.
Internal medicine?
Internal medicine.
Okay. In Orange County?
In Orange County.
And what's your role with Benev?
So I actually started working with Benev a couple years before Ethan did. So in 2002, I actually headed their biotech sector, and then it translated into more of medical aesthetics, growth factors, wound healing, et cetera, and that's kind of where we are today.
So you're doing both. You're practicing clinical medicine as an internist, correct? Yeah.
Well, so I mean, I'm as an internist, I use that as kind of my background. I have patients that I see, but it's generally regenerative aesthetics.
Oh, I see.
In practice.
So do you measure things, hormones and so forth, and give supplements to people? Like, that I hear about. I have some friends that were anesthesiologists, and now they are doing like testosterone pellets and all kinds of things, growth factors.
Yeah, I leave that to others to do.
Okay.
Yeah, I focus kind of more on big picture stuff, and as of late, exosomes have been the hot topic.
Yes.
Right. So that's just kind of, we've just been building off of our experience. Going back almost 20 years ago, kind of being the quiet movers and shakers behind the growth factor industry and medical aesthetics, right?
Yeah.
To now kind of being thrown into the forefront of being the kind of the leaders in terms of exosomes, exosome technology, and the application of that to medical aesthetics.
So let's start with the number one question I'm asked. What are exosomes?
Why are you asking that question? You already know the answer to that.
But it's interesting to hear from both of us because again,
No,
I
want to hear both. I'm going to
guy.
ask you from a different point of view.
Scientist
But you're the
versus-
physician and
yeah.
scientist.
Yeah.
And I was just asked out there today, we'll start with just from 40,000 feet. What are exosomes?
Yeah, so exosomes are naturally secreted nanoparticles that are secreted by proliferating cells. And they contain genetic material, they contain growth factors, they contain all these other things that really help mediate cell-to-cell communication.
Okay. And where do they live? Are they naturally occurring?
Oh yeah, they're naturally occurring. They're naturally occurring by pretty much almost every cell in our body, right? And
So everyone has exosomes.
everyone has exosomes. So if we were to get a blood sample from you or anyone else in this room, I could extract out exosomes from you and profile it. Yeah, definitely.
What does it mean to profile an exosome?
Okay, so it means to really delve into what are these exosomes made of, or what do they possess, right? Because I think the big question here is, what are exosomes, but how do we use them in what we're trying to do, right? More specifically, we're talking about medical aesthetics, and we're talking about beauty and how to make us appear younger and feel younger, right? And so we talk about wrinkles and how to get rid of wrinkles, how to get rid of age spots, et cetera, right? So what factors are present in these exosomes that help contribute or help modulate these processes? So in terms of profiling, I guess that's a general term that I'm using, but it's really delving into like, what do your exosomes have, right? And you can list all these different things, or you can measure all these different things in our exosomes and be able to profile it and kind of categorize it, so to speak.
So can exosomes be made in a test tube? Can they be made synthetically, or are they always biologic?
They're biologic.
Okay. And are your exosomes the same as my exosomes?
Are they the same? Are they similar? Yes. Can they be exactly the same? Probably not. We all have a different signature footprint, so they're slightly different.
Okay. Now, turning to the CEO, what are exosomes?
Well, you should have asked me first. Not fair, because the scientist just answered that. But
From your point of view.
yeah, for me, obviously, exosome is again bilipid membrane that are secreted by proliferating cells that has, again, this is my sales pitch.
Yeah, that's
right?
fine. I want to hear it.
Anti-inflammatory, and then again the actual regenerative aspect with the dermal remodeling function, as well as the skin barrier function recovery. So these are three top function of exosome that I learned when I saw it. This would be great product for a post care, right? In regenerative aesthetic field that we have.
Okay.
So so that will be really a definition that I have, and I think it's one step further developed from the concept of the growth factors that we know of in the past, because it really elevates the concept where growth factor was still very, very functional and they can use for the same reason. But exosome is more of a package, right? As a one particle, right, with the spheres that contains growth factors, interleukins, all these microRNAs, that now the communication method of growth factor will be more of a single text messages. Exosome will be more like a virtual communication, like we're communicating more in total messages, and I think that's where the power of exosome lies, and it's more complete messages that your cell will need when they going through the recovery or to the regeneration. So that's when I saw, after coming from a company that manufactured growth factor product for a long time, this will be our holy grail moving forward. This will be a future. And that's when I went to Dr. Jin. I think it was like 6 years ago. We should evolve and move up, right? Starting exosome versus, existing growth factor business that we have. And then again, it was no longer sexy because again, it became a commodity within industry where we have about 20 growth factor product lines in the industry now within medical aesthetics, which we were part of at least 6 or 7 different companies as well as far as a manufacturer.
Okay.
So we wanted something new. I was looking for a more sexier, a better story with the science, and exosome was just a perfect approach, and the transition from us being a growth factor experts into something that are also related to the growth factors, but it's evolved and something better.
And are exosomes always put on topically?
Yes, it's with our current products, it's a topical skincare as a category. So yes.
Okay, so we're not eating them, we're not injecting them, either
Nope.
IV or IM or
Nope.
sub-Q. It's a topical application
Yes.
of these exosomes.
Yes.
And you say post-procedure, do you mean like post-laser? Could you elaborate on what you mean by post-procedure?
Yeah, so we're in a medical aesthetic industry right now, and then again, there are about 24 of the very good skincare line products in the industry that basically come up with a product that are to be sold to the patients. So when they walk out of the office with the procedure done, whether that is lasers or RF or ultrasounds or RF microneedlings or chemical peels, right? All it is to create controlled damages, not damage, but controlled damages by the professionals,
Right.
with the precision of these energy-based or other devices, right?
Yes.
That they can't just left out there, right, and expect the patients to basically recover, given the situations with the suns and exposure that they're going to have. So the recommendation is that you would use these particular products, right, to help recover, right, from the treatment you just performed. And in the sense of, yes, there will be inflammatory problems, inflammations with some of the treatments. There will be a skin barrier damages that you need to recover from. And then obviously you need more collagen and elastins to heal up for dermal remodeling
Sure.
purposes. So that's where I feel our exosome fits 3 old categories, where that's what we need to see as from the doctor's standpoint when they send the patient home, right? When they come back, you want really that 3 area to be recovered, right? That's why I recommend our product being used as a post care.
And do you recommend it as a pre-care also?
We actually are not recommending exosome as a pre-care, but sometime when they try to build their skin condition for aggressive treatments, yes, in that sense. So that you would a microneedle with, let's say, 0.3 millimeter, right?
Okay.
And then you would apply exosome, and then your skin thickness is improved. Because there's a lot of trials and studies that are done that have just microneedle itself could basically thicken the skin without aggressive energy base. Then they could be ready for maybe more aggressive treatment like CO2 fractional lasers, right? For different purposes.
Okay.
Maybe then it can be used as a pre-treatment, but we're not recommending uses of our exosome for, let's say, right before treatment or like 2 weeks before the treatments. Basically, you would do the laser treatments, and then again, immediately after the laser procedures, right, you can get our exosome topical application on site by the providers.
And do you, Dr. Jin, do you actually do these procedures on your patients? I know you're a physician.
Yeah.
Are you doing the procedures that he's just mentioning?
Yeah.
And then you're putting your patients on this topical exosome to help accelerate healing, correct?
Yeah, it's basically in my practice. I mean, if you look at the history behind kind of the regenerative, aesthetics,
Okay.
right? it was going back almost 2 decades as growth factors, and then PRP got really hot, right? Like using platelets and using their innate properties and for healing, for like the vampire facial or for hair regeneration. It works great, and don't get me wrong, right? Then on the echelon came like stem cells and like, oh, how do we use these things because they have a higher therapeutic kind of potential compared to those other two that I just mentioned, right?
Right.
And now we have exosomes, right? Because now you don't need the stem cells, right?
That was my next question.
Right.
So exosomes have replaced stem cells?
I'd say in a lot of...
At least for topical, I should say.
Yeah.
Topical. Yeah.
Because I wouldn't know
Topical.
what stem cell would do topically. That's why I always ask Dr. Jin, what would topical stem cell will do? But in the industry, there were a few topical stem cells that are being sold. And some of the doctors are utilizing topical stem cell after, quote unquote, procedures for the recovery purposes.
Yeah, but I mean, the argument behind that is, or the justification behind that is, it's really sometimes it's the exosomes that are being released by the stem cell. So you're using the stem cells, but what are the actual actuators of healing or anti-inflammation, right?
Okay.
And more data is actually showing that's actually the exosome. So kind of how Ethan pointed out earlier about kind of this trifecta of the innate properties of exosomes. So it's like all these goodies bundled into one thing, right?
Okay.
You have anti-inflammatory properties, right? You have the ability to remodel the dermis, right, with more collagen and elastin, right? You have the ability to thicken the skin layer, right? So you're able to do all these things, and it's crazy to think that exosomes, this little nanoparticle, they're about 100 nanometers in size, has so much potential, has so much packed into it, right? So it's really kind of changed the conventional way of thinking and really changed the paradigm in terms of regenerative aesthetics, right?
When were exosomes first discovered?
Oh,
if you know. And a follow-up question is, who made up the word exosome? Do you know? Or is it a made-up word? I mean, it sounds
that's a good question.
to
I'm not.
me.
I'm old, but I'm not that old.
The first, based on my knowledge, it was started in 2009 when there's published article came out, and before it was considered just a waste of the cell. Like all the people would see the exosome more like a pockets and spears that are being released by the cell. And then they're thinking that it was more of waste. But then again, I think the 2003, and then as time goes by, they were thinking this is just not just a waste. And I think 2009, there were first that actually found that this isn't just a waste. There are something that are critical inside of these spears. And that's 2009. Some of the early advisors of our product lines, Dr. Lim from Singapore, she discovered adipose-derived stem cell exosome for the first time. And she's famous stem cell. And Dr. Jan, who's in Sweden now also, he's one of the expertise within exosome field. He was a part of the Kodiak when he first start his own company, and he's no longer with the Kodiak anymore. Kodiak is the only company that are publicly traded in the United States with exosome focus.
Okay.
But anyway, so these are the people that are play heavily in research in toward end of 2009 and 10, and in the beginning of 2000, I think 13, 14 area at the time period. They were publishing a lot of articles, but that's really not aesthetic, not a medical aesthetic. That was really more of a scientific era.
Okay.
And most of the people that are involved were scientists, not the medical doctors. No, I think there are still pretty big community out there. But as to the exosome within the medical aesthetics, I heard word exosomes in 2016. That's when I first heard.
So that's not that long ago.
No. And then that's when we were having conversation about. And because we're already familiar with the growth factors. And then we were start looking into the exosome as far as 2017. And then within a few years, basically, we were thinking, oh, this isn't really that different. It requires more technique, more skill, right? More studies to make sure that we can actually extract and isolate it, and then again put into a product where even we consider to be commercialized. So that's like 2017, like
So
only
where
five,
do you
6 years
get the
ago.
exosomes that are in your product? Are they from patients?
I mean, the cell sources are adipose-derived mesenchymal stem cells
Okay, and you harvest that fat from
from a patient.
patient, and then from that fat you derive the exosomes, and you put it in the product that you give to many other patients. Is that correct, or is this just for the patient? In other words, is the patient have their own fat that's turned into the exosomes?
So it's the people will use word donor, but there's a specific terminology that are used in the country where stem cell products actually it was registered as a medical device is Korea. They have what we call master stem cell bank,
Okay.
right? So which means is that the government actually regulates how the company would handle the stem cell, right? Starting from selecting a donor, screening them, right? Not only screening their individual, their health condition,
Okay.
and then get a donation of actually adipocyte, basically, and then get the stem cell from, and then screen the cell.
Okay.
And then again, there is a complete process of a company needing to go through, and then again be under the KFDA regulation. So now we have that particular sources that we're getting our exosomes from. We have 3 quote unquote easy word donors or master stem cell bank
Okay.
that we actually, and then again age of between 21 and 23.
For what, the donor?
Yes.
Okay.
So which is the stem cell. It's basically, but there are 3 donors behind it, where we actually have our own master stem cell bank, where we have probably we can use for about 20 more years with their cells if you maintain and keep it in a way they wanted it. And we for the purpose of the development, we might have to add a few more master stem cell bank, but each process require about $300,000 investments from the beginning to the end until we finally able to use it for the manufacturing. So it's like a donor of super donor of what the industry term people uses it, but there's specific a term that people uses when to describe a source of the cells for the exosome productions. So we have that in Korea now.
And is that the product then you bring to the United States?
Yes.
And then the patient or the customer who puts it on their skin, they get it from the doctor's office?
Yes, it's doctor's office.
Do they get it over the counter ever?
No, it's doctor's office only.
Okay.
And we still don't have a products that doctor dispenses. Basically, although we are categorized as a skincare, and it is, but we recommend to use our products only at the office, by the doctors or by the providers, right, as an immediate post-care.
Okay. So the patient doesn't take it home with them?
No, but we're actually coming out with the new products now that a doctor could recommend for patients to take home with. But there's challenges involved right now because we can probably get into the whole conversation about the how to store exosome. We haven't gone into it, but our goal now is to launch 2 new products as a post-care, not only at the doctor's office, but post-care so that they can take home with. But the critical part of that is that product will be recommended to be put in the refrigerations. So it'll be a little challenge, but that's the only way we feel that we're say with our scientific foundings of how product being viable and more efficient when it's stored in the minus 10 Celsius refrigerations.
So when Dr. Jin buys the product that he puts on his patient's face, say, he buys it from you, from the your company, and is it refrigerated at all times? Is that
Yes,
it comes to you
comes
refrigerated?
overnight. Yeah.
And does it stay in your refrigerator?
Stays in the refrigerator.
And the source of the exosome is this donor bank that's in Korea.
Yeah.
Interesting. And then how do you control dosing? Do you know how many exosomes there are per cc, or I mean, do you quantify the exosomes, or?
Yeah, I mean, there's a way to quantify exosomes. So the way the exosome regenerative complex is sold now or offered, we don't like to go into numbers too much because people they get so fixated on how many billion and this, and like I have more than you, so it should exert a.
I'm not going to ask you what the number is.
Oh,
I was just wondering if you do know the number.
Oh, yeah.
I'm not going to ask you what the number is because it wouldn't mean anything to me.
Yeah.
But okay, so they come from adipose cells, which are fat cells.
Yes.
You are at the bank. They derive them there in Korea, and then they send them to you here in Orange County, I assume.
Yeah.
And then you put them into what a jar or a tube or
Yeah, so it's all a process that we have right now, although we can't make a claim that this product is sterile because once you say it, it becomes a drug immediately, right? So, but the products are manufactured in very clean, sterile environments.
Okay.
Right?
Fair enough.
So that we don't say it's a sterile product, but again, it's manufactured within a sterile facility.
I'm
Right?
with you.
Yeah, so, and then again, it's lyophilized, which means dry freeze.
Yes.
And then for that matter, we could, instead of freezing it in minus 20 or minus 80, which is required by many other companies that are out there who handles exosome, we say it's stabilized so that you can actually store it in refrigeration instead of
A normal refrigerator.
normal refrigerators. Right. And then we would ship it out overnight to our customers around the country.
And then do we in the office, do we have to prepare it somewhere? Or do we take it right from the container and put it on the patient's skin?
No, yeah, so it's really convenient to use because it comes in two separate vials, and one is the lyophilized exosomes.
Okay.
The second vial is a diluent, and I'm using my hands.
Yeah, that's fine.
Right. But
That's fine.
the second vial is a diluent. It's a HA-based or hyaluronic acid-based diluent that you
Okay.
basically reconstitute the lyophilized exosomes.
Got it.
Right, and then with after you add them together, it's maybe 5 or 6 minutes at most, and it's fully dissolved and reconstituted, and then you can use it topically.
So I have a question how it gets across the skin into the cells. I assume it's into the dermis, or is it subdermal?
Well,
And is it the fibroblast that turns on, or is it?
Well, so it depends on what modality you use to get the product there, right? Because you could have the greatest thing, but our skin does what, right? It keeps things
protects us.
out, and it does a great job of doing that,
Yes,
right?
that's why my question.
But now what we're trying to do is we want to get the exosomes or the goodies into the skin to exert its beneficial
Precisely.
effects, right?
Yes.
So that's why we have microneedling, you have radio frequency, you again have ultrasound, then you have lasers, right? These are all modalities to break that barrier or disrupt that barrier, right?
Correct.
To help whatever you're going to put on the skin absorb,
Okay.
right? So any of those that I just mentioned, you use that to disrupt the barrier, and the exosomes will naturally just absorb down into the skin.
And then they use them daily until the barrier is reconstituted or the healing is over.
That would depend, because then you get into this whole philosophical argument of, like, let's say if you microneedle, how long do the channels stay open for?
Well, that was going to be my follow-up question.
Right? We could argue about that all day long, right? But I think that the most effective way is to use some type of, either a mechanical or energy process to disrupt that barrier, and then to apply the exosomes right afterwards.
Okay, so that's the day of the procedure.
Right.
Patient goes home. Do they keep putting it on at home? Or
Right now, no.
Yeah.
okay, so it happens at the doctor's
That's
office.
it.
You broke down the stratum corneum with your drill holes or whatever you're doing, laser, microneedling with RF, microneedling plate.
Yeah.
That opens the tunnel or the channel. The exosomes go down the channel, and then where are they active? Is that at the fibroblast?
I wouldn't go that deep because of the whole issues with the claim. Because again, if you may say that it penetrate to the level, then it'll be an issue. So,
Okay.
what we now with the post care with uses and benefit that they see is the whole epithelial and above, and
Yes.
then obviously epinormal cell also too.
Right.
And then again, a lot of time we stay with topical claims, right? With the with the surface level of the skin. I guess when we get into the whole dermal layers of fibroblasts and all the other area and layers that we talked about, it become an issue, right? Because again, there are other ingredient that willingly we say, because it's penetrate and FDA be okay with. Glycolic acid, for instance.
Yes.
Is something that our grandfather in. Some of the chemical peels, right, still under cosmetic category, but we all know that they penetrate, but FDA said it's okay to say it because it's grandfather in. Exosome is not that ingredient yet.
Okay.
So we should definitely be a little more careful when we talk about the penetration.
I got it. I'm not trying to get you in
No.
trouble. I'm just trying to understand and form a picture.
Yeah.
And I know our watchers, our viewers and listeners have the same questions.
Yeah.
Because it's certainly the buzzword.
Yeah.
At Aesthetic Innovation Summit, I kept hearing exosomes, exosomes, exosomes.
Good.
And it seems to be one of the biggest buzzwords in aesthetics lately, and trying to get a handle on it.
Yeah.
And I know others are also trying to figure it out. Now, it's made in a sterile environment. We're not claiming sterility, but it is.
Yeah.
But it's made in a sterile environment. And then you apply it. How do you apply it to the skin? Is it with your gloved hand? Is it with a syringe? Is it with a tongue depressant? Or all the above? None of the above? How do you put it on your patients? I'm just curious. And is it a liquid when you do it?
Right. So after you reconstitute it, it is in a liquid form.
Okay.
Because of the hyaluronic acid that's in the diluent, it's nice because it's a little viscous. It doesn't just like run off like water.
I got it.
Right. And I mean, with any procedure, you want to, whether you're doing it sterilely or not, like your procedure itself.
Yes.
You want to, I think, practice, clean practices, right? So
of course.
at the least have a glove on, right? And then be able to either use your a plastic applicator, or some people will use a gloved hand as long as it's clean, right? To help, I guess, massage it in or cover the skin that you just went over with your modality.
So it's easy. You just put it on and rub it in a little bit?
Yep.
So the concept would be very similar to a lot of people that are doing the PRP facial.
Yes.
Right? The PRP, some people will do PRP for injection, but PRP facial is really the concept that you can picture yourself, and then again, if you use our exosome, it'll be exactly that. Topical, right? You put it on top, and then whether they use it with the needleless syringes or just the hand applications. But then solution has got a little more viscosity, so it'll be more easier to keep it on and then again apply product with.
When you talk about PRP, are there exosomes inside a PRP?
That's a really good question, and that
Okay.
we should have
So
an
do
answer
we,
for.
are we talking about, if you want to get really semantic about it, are we talking about PRP or are we talking about platelets? They're two
Well, when you
different
talk about PRP facials,
right,
what is that?
right.
Is that PRP or is it platelets?
Well, PRP is made up of platelets, but it also
Correct.
has plasma.
Right.
So let's say if we are to use PPP, platelet poor plasma, instead of
Right.
platelet rich plasma, are there still exosomes in the plasma?
That's my question for you.
Oh yes, there are.
There are.
There are.
So that's another way to get exosomes?
Oh yeah.
But it's less efficient? Is it less concentrated?
As opposed to,
As opposed to the technology out of Korea, what you're doing?
well, it's a different source, right?
Oh,
so
it's platelets instead of adipocytes.
right.
You're
So
right.
I mean, if you think about and you get really technical about platelets, I mean, what are the most common growth? Let's say growth factors. What are the
Okay.
most common growth factors associated with platelets? And when platelets are activated, what are these goodies that you're relying on to help rejuvenate the skin? Right. You're talking about literally 3 or 4. You're talking about platelet-derived growth factor, PDGF, TGF beta, transforming growth factor, and you're talking about EGF, epidermal growth factor.
Right.
Aside from that, you don't have that many more growth factors that are actively released when platelets are activated. These are native platelets.
Okay.
Now, if you're taking plasma, so you have the platelets and now you have the plasma, so that makes PRP. In our plasma, we have a ton of other exosomes or growth factors in there.
Okay.
We know this because I've seen it. We've run these studies and we've profiled all different sources of cell types, and it's amazing because they all have a different footprint, right? So if you were to compare strictly platelets, right,
Yep.
versus and the exosomes from the platelets versus exosomes released by adipose cells or adipose-derived mesenchymal stem cells,
Okay.
there's a huge difference. It's night and day different in terms
In
of
terms of quantity or quality or type of exosome or all the above?
All the above.
Really?
All the above, right? Because you talk about profiling exosomes, and you say, well, how many growth factors could possibly be in an exosome, right?
Okay.
And it depends on the cell type, all right? So if you're asking me, if you profile an exosome coming from a platelet, how many different growth factors do you expect to see? I wouldn't expect to see more than a handful, to be quite honest with you.
Okay.
From a native platelet.
I got it.
Whereas adipose-derived mesenchymal stem cell, how many growth factors do you expect to see? We've already shown it. There's 50 plus. I think now it's closer to 100 different growth factors.
So the adipocyte's a better source.
It's really the choice I think we made.
Yeah.
And we when I first asked, we discussed, it was a choice that we made because there are more studies that are being done and published with adipocyte stem cells.
Okay.
And there was a safe issues when we first looked into the 6-7 years ago. So that was naturally first cases that we looked at the placental base, we looked at all the different cell sources. We saw there are just tremendous amount of the published paper regards to the adipocyte, adipose-derived stem cell.
Yeah.
So that's when we decided, okay, this would be so much better option from the safety standpoint. And then secondly, the cost aspect was a big deal, right? Where
In what sense?
from getting a source of making up basically the master cell bank, right, with the source being easier, basically with having that adipocyte versus the placental base, right?
Uh-huh.
And so and then as far as the profiling everything, and then after we decide that factor, we were able to find a lot of different growth factors, and then again, as we were doing the profiling, there's abundant amount of things that are already enough to begin with, that we don't really need to look at other sources, because if this is true and viable, then this is good enough, right? So I think there's a lot of debate still going back and forth which sources are better, but I think our attitude is really we chose our sources for this matter, right? I don't want to say our source is better than other, because again, the placental base, there's so much more they can find out moving forward that it's something that we don't know to begin with. And then again, I don't know, it could be in scientific arguments, which is a good thing between scientists. But from my standpoint, I think, as I said, there's a business reason as to why we chose the source that we have.
Oh, sure.
And then, I mean, that's probably as far as I can go, And I think that our product's great, but I don't want to say our source is better than other sources.
I think from a quantification perspective, yes, adipose-derived or exosomes from adipose-derived mesenchymal stem cells have way more growth factors, interleukins, cytokines, microRNA compared to other sources. Now the question is does it make, do you see that difference just because it has 50 times more? Are you going to see a 50-fold increase in clinical efficacy, right?
And do you have the answer to that?
I think the answer still remains to be seen.
Interesting.
Right? So I think in this realm of regenerative aesthetics, I think there's room for all of us, right? And I think what's great about it is if we can be transparent and collaborate, right? Because and we have to look at it, the big picture rather than, hey, I'm the best, ours is the best, right?
Or the first or the newest.
Right.
Yeah.
But I think the field is still very young, right?
Yeah.
So we're talking about like medical aesthetics. There's others in the medical industry talking about therapeutics and how do you apply this to different clinical
That's one of my
scenarios.
questions. Are you putting it in joint spaces or using it for ortho or non-beautification things?
So it's in the pipeline. Obviously, we know it's basically, realistically speaking, probably 7 to 10 year process.
Whoa.
The earliest, based on the resource that we have, based on the step that we take, in our partnering company in Korea with our sources and the studies that are being done. But that's certainly an area that we've looked at it from standpoint of how we could come up with the exosome solutions could be injected, right, to be commercialized as that. But there might be a way, just like how PRP became autologous, and then again it's medical device, and how the doctor could utilize the kit right, to get the PRP from the one's bloods, right, and then inject it, right? So that might be the way for us to go around with exosome. If you can come up with an autologous way of extracting exosome from your own body, for instance, your blood, and then we have enough quantifications as to, okay, if this would be enough to treat or be a good enough to have a therapeutic benefit, right?
Are you looking into that right now?
We've been looking into it for a while, but it's challenging. Definitely
That would be very exciting.
Yeah.
And then
Because we're not looking at a approval as a drug or biologics. We're looking at more of a medical devices who could help, right, for doctors to get it as an autologous solution from patient's own body, right? Right now, process will require, based on our study, that a certain level of a proliferating, the culturing process, which is the big issue by FDA. So without culturing the cell, right, can we just get it from the blood? Can we just get it from the urines, basically? Or can we get it from somewhere where they can, inject back in? But it's challenging. So it's years of work that I think still needs to happen.
Let me ask you this, Dr. Jin. Have you done any split face studies, blinded split face studies?
Yep.
You have. So on one side, you put the active ingredient. On the other side, you put an inert, non-active, non-exosome.
Right.
And what have you found?
We found dramatic improvement in skin quality. This was the acne scarring study. Yeah.
So
Was it like laser or what was the modality?
So the CO2 fractional lasers was
Okay.
used as the modality, which is known to be the most aggressive lasers out in the
Absolutely.
market.
Absolutely.
So we did blind studies for the half face with exosome, without exosome.
Okay.
So we are the first company that have published as far as the clinical trials, right? So I think, correct me if I'm wrong, I was trying to find out if there's any other clinical that are published or peer review with SCI level. I couldn't find anything else but us. So I can only just don't quote me on it. But again, as far as I'm concerned, I don't think still there's a lot of buzzword out there, but there's a lot of white papers out, right?
Yep.
But I haven't yet to see a real blind faces clinical trial study done. But we already published it 2 years ago. So that was the first topical application of exosome.
And where did you publish that?
In Europe. We were trying to stay down low because we didn't want to get it strongly faced with FDA. Because somehow I was trying to play very safe. So when our partners would discuss about it, let's publish it. It's actually ACTA. It's very famous derm-related journals for the acne. So it was acne scar with the CO2 fractional lasers. And so it's available on our website, and we basically make it known to everybody. We just submitted 2 studies in U.S. with both of them with the microneedle.
Okay.
Right? As a post care for the.
And was it
wrinkle.
for acne scarring or
No,
was it
no,
for aging, like
aging,
wrinkles?
wrinkle, and then for the hair as well.
Hair.
Yeah, for the scalp regenerations.
Boy.
Yeah.
So now we're talking hair. So hair growth.
Scalp rejuvenation, we call it scalp health, but obviously the outcome will be, basically that people stop losing hairs, and then again, I can't disclose the data right now because we just submitted it a few weeks ago.
That's okay.
But we're kind of excited to see that how you can treat the scalp just like how you treat the skin. It makes sense to bring back the cycles of skin, bring back the cycles of the scalp with the follicles. And then again, it's natural for us to, even scientific assumptions that you may bring back the function of its own, right? When
That would be fantastic.
Yeah.
Do you use that in your practice?
I do.
Or can you? Yeah.
So that's
I figured
to
so
study.
much. You were originally bald, right? And you grew all that hair?
Sure.
That's it. So I think that's the idea. And Dr. Jin was involved in some of the in vitro and in vivo studies, obviously earlier, where I think that's something that I always like to highlight because I'm not a scientist. But when I look at it, I look for scientific validation. I'm not a inventor or anything, but when I look for technology, as you always do, I look for validation of technology. And then again, how do you validate the science, right? I can't just listen what he's saying as a scientist and that's great. But how do you validate that? You have to basically have it peer reviewed by other scientists. And the way you do it, basically publish it, right? So I haven't seen any other competition have that type of, as a company, as an individual may have. But we actually stick our name out and we make sure with our partner company that we do all the in vitro, in vivo, ex vivo, and the clinicals. And again, that's the way you usually go about when you develop something that are, not only valid in the clinical aspect. And yes, I understand. If works, it works. If you put it on, works, it works. But do you have a actual scientific study and data to prove that the product was worthy of putting on the skin of the patient?
Yeah, that's the question.
Yeah. Have you done your in vivo study, right, before you jump on, all right? Start putting it on and see if it works or not. Have done actually in vivo study, making sure that it actually there's a clinical outcome at the in vivo level. And I think that's what made us differentiated even before we launched our product 4 years ago. We already have that study mapped out.
And what is the product called if a patient wanted to ask for it who's watching this program right now? How would they ask their doctor? Or
it would be a product name is Exosome Regenerative Complex.
Exosome Regenerative Complex. Okay.
And then we have Exosome Regenerative Complex Plus.
Okay. And what's the difference?
Just more higher
concentration.
Dosages,
okay.
Concentrations. And ones really are for skin. And then again, the second one being a little higher dosages for the scalp. So that's kind of how we position our products. And these are all done in a professional setting, so it's not being sold.
Right.
For a few reasons, we want our doctors to engage and communicate about the science of exosome and the benefit of exosome. And it's really difficult now concept for a end user or patient to understand, I think.
Yes.
Eventually they will, just like how growth factors were. And then second, we wanted to spend our time making sure that we perfect our products with the scientific evidence. Because again, now we don't have enough of data to show the stability or viewability of the exosome in room temperature. So we speak out loud that we don't have a confidence in the formulation that we have, right? That once it's keep it in room temperature, product will be viable. So we wanted to kind of stay within professional setting where everybody's so used to, right? Having the product just like Botox and being refrigerated,
absolutely
constituted and using it. Now that one that we're going to come out with soon with exosome that are being recommended sold to the patient, it'll still be a post-care, but we're going to probably ask, right, our patients to make sure when you bring it home, 24 hours okay, make sure you put it in your refrigerators and then for the best of uses.
That makes sense.
Yeah.
Fascinating. One last question regarding exosomes. Can other skincare companies get your exosomes or the Korean exosomes and put them into their skincare lines?
We've been asked by it. Our answer has been no.
I see.
Yeah, from our sources in our manufacturing.
Okay.
So we've been asked by many other medical device companies.
I would think so.
Yeah.
I would think other people would want to get their hands on it.
That was what I was doing when I first launched the growth factor businesses back in 15 years ago. That we started our growth factor product lines. Once we launched it, there were a lot of issues with the FDA looking at growth factors like, oh, you guys are making too much claim. Are you guys doing it as a skincare? Is that a drug? Medical devices? We were skincare, and once the words kind of went out and then popular, a lot of company wanted to manufacture. So back then we said, yes, why not, right? It's technology. And then again, we wanted to stay kind of down low because of the FDA were keep pounding on us, asking us the question.
That's
but anyway,
not going to work.
Yeah. But this time when we talked about it, let's try to focus. And then again, this time we want to be the one that handles and then again directly with FDA if there's any issue.
Sure.
Right. And then again, we don't know how this is going to evolve at this point. But we wanted to be at the core of our brand building with our products that are linked to the technology that we have. So then answer to these requests that came in that they wanted a private label. Answer was no, but that was a business decision. So it may change moving forward. But up until now, that's just what it is. But as far as other sources, there are excellent companies in South America. There are excellent companies in Europe. There's excellent companies in Asia. Lots of excellent companies in China, by the way. So you'll be surprised. You will see some of the product coming into the market.
Are they all topical? All those ones you're talking about? Or are they also injectable?
none of them are injectable,
Okay.
period.
Okay.
There are no single injectable product that are approved based on our knowledge, right? All of them now start saying they're topical, which is a good thing, right? Before they were saying they were injectable, but now because of FDA, now they're saying topical.
Okay.
Which is
So
the
that makes it
words
easier.
that I've been communicating and emphasis that I've been communicating with the industry, meaning
Yes.
all the competition, which I know of, that you guys really need to come into the light of using the proper word instead of saying this is the exosome skincare. They would hide their mouth when they say skincare. It's like you should say exosome skincare. That's the only way, right? You can legally commercialize this product now in US,
Right.
and elsewhere the same way, by the way, right? So, I think it's a good sign now. The few other company came out after us. Now they're claiming skincare, which is very smart. They've done their study, making sure that that's the only way to commercialize exosome now in the market that we're in.
Fascinating.
And I feel like I've deserved the recognition because I've been communicating
you
with,
personally?
Yeah.
Okay.
Because I've been communicating with all of them that I want the competitions to grow, right? Because again, I can't just be a single company and then grow because we need the competition. We need a challenging, right, to improve and develop better,
Our
right?
last guest just talked
Right.
about that.
Right. So
Rising tides. So
reason-
you want everything to go up.
Yeah. Reason I respect me being Korean is one thing. Reason I respect the Korean industry when it comes to aesthetic is because competition is what's driving the industry. It's amazing how a lot of good competition happening. But again, it's sometimes brutal. But good technology goes down because of competition, right? But I think that I've seen how some of the technology kind of grow, but you need the industry to grow together. You need other competitions, right? I think that's kind of way I see it, and I was happy to see the competition coming out because again, we've launched our product 4 years ago. Product you see now is a product we start selling 4 years ago.
Okay.
But I see a lot of other competition changing their product every 6 months because they try to keep up with FDA regulation, right? Changing their labels, changing their claims, and changing how they approach and how they sell to the doctors. I think that's a good sign because I think that everybody try to stay and walk into the playground, which I feel very safe, that I created. And in order for you to stay legal, commercialize it, this is the way to go.
Perfect.
Yeah.
Anything else you'd like to add?
Anything else?
I know I've learned a ton.
Yeah.
I think these are exciting times, and like I said, I think competition really spurs innovation too. So it's great that a lot of us or a lot of other companies are jumping into that space. But I think behind it and anything that we do as practitioners to patients, I think we have that responsibility to be able to make sure what we're using is vetted, right? And
Right.
Instead of, sex sells, right? If something is sexy, it's great, and a lot of the market is driven by marketing, right? But you always want to make sure that when you're dealing with something, especially in the regenerative realm, that they can back it up with
Absolutely.
data, right? And I think we just need to practice responsibly, but it's fun, and I think there's going to be more to come in the next couple of years.
Oh, yeah, very excited to come. And as a company, the Benev when I look at the product, is that we manufacture our product, but we also recognize other technology and then use our companies to be introduced into the market. For instance, we bring some of the product from Korea to US. We are involved in every single step of the way, from the development, manufacturing, all the way to the registrations, to the marketing and branding, right? I think that's our know-how, but the core principle behind it is that it has to be validated with the sciences, right? Do they really have that core science that are being validated by other peer review article technology? It's my word against your word, right? I invent something really cool. Who's gonna know? Is there a patent behind it? The company will spend time and effort with the inventor behind it, right? To develop a technology, right? That's really the core. And then the final aspect is the regulatory, right? I could be in a gray area and be in a certain way, but we need to make sure that these products, especially in medical aesthetic or regenerative aesthetic, we need to kind of clear out, right, as to how these products are being categorized and labeled. That way, doctors can use off-label, right? We don't want doctors to use illegal label. We want them to use off-label if they may, because it's their right.
Right.
So these are the three key elements us as a Benev company look out when we introduce a product into the market. And we want to make sure that all the due diligence and then again work's done prior to launching the products. And I think that's very, very important. And what I've learned from industry, being out here for the last 18 years, and I tried some of that, just prematurely launch something that are not being validated with this core principle. But now everything that we are going to introduce to the market moving forward as a new products or technology will be under that core principle of the validated science, validated technology, and validated in the regulatory aspect. So,
well, that will serve you well.
Yeah, I hope so.
Well, I want to thank you, gentlemen, for coming here, for coming all the way from Korea.
Thank you. I got to go back to Korea again.
You may have come the furthest. I don't know which is farther, Korea or Switzerland.
Yeah.
We did have one guest from Switzerland, Fleming from Galderma.
Wow.
But,
yeah. I think I saw that one.
Fleming, yeah. And Benev, well, it sounds like quite a company, and you guys have been there with them much longer than I had any idea.
Thank you.
And I look forward to seeing how you're going to keep developing it. It seems like you're scratching the surface, and it's a really exciting field. Be sure to look into the Aesthetic Innovation Summit that we do before the Aesthetic Society every year. I think your company would be positioned very well to present there at AIS, or it's usually the day before the Aesthetic Society meeting. I'll give you some information on that. And I want to thank all of you for joining us today at the Technology of Beauty. And you just learned an awful lot about exosomes by Ethan here and Dr. Jin from Benev. Talk to you soon. I'll see you next week.